Good morning. I am Dr. Sujata Kar, a gynecologist who has been practicing in Bhubaneswar for almost 30 years. Today I'll be speaking about tips for pregnant women during the corona pandemic. And my tips are based on recommendations from FOXY, which is a large body of 30,000 gynecologists of India, and also Royal College of Obstetrician and Gynecologists, which is a large international body. So, being pregnant does not increase your chances of getting the infection. To reduce the risks further, follow the government guidelines. Basically, do the 5 things. Stay at home, wash your hands repeatedly, avoid touching the face, nose, eyes, etc. Respiratory hygiene, which means how to cough, how to sneeze, follow those guidelines, and keep distance from others, at least a 6 feet distance from others. If you are a working woman and pregnant, as far as possible, work from home. If that is not possible, and if you are in a public facing job, then try and use personal protective equipments as far as possible. For example, masks, eye shields, gloves, whatever is practical and whatever is possible in your circumstances, use that. But if you are pregnant and have any high risk disease like diabetes, asthma, or heart disease, then you must take leave and stay at home. Do your regular antenatal checkups. So basically, maternity or pregnancy is considered as essential services, and you must be in touch with your gynecologist on a regular basis. However, the routine tests, the routine ultrasounds, and the routine checkups may be deferred a little based on what stage of pregnancy you are. And usually during the coronavirus lockdown period, you may be asked by your gynecologist to defer your treatment or to defer your usual checkup. Some of the checkups or some of the consultations can also be done over phone, Zoom, or video chat based on what your gynecologist is comfortable at. If you have any symptoms like cold or cough or shortness of breath or fever, do not go to a hospital, stay at home, but consult your local doctor or your family physician and follow as per their advice. Now, if a pregnant woman does get the infection, then please remember some points. The chances of miscarriage are not more. The chances of coronavirus passing from the mother to the baby is not really known, but what is known now is that it does not increase the chances of passing the virus to the baby. About birth defects also, it is not very well known. However, the chances of increased birth defects have not been noted. If by chance you have been asked for self-isolation, or you've been asked to go through a self-quarantine, then you should not go for your regular checkup. You should inform the authorities regarding your condition, and they should look after whatever your requirements are based on your status of your pregnancy. In case of a coronavirus infection in a pregnant woman, please remember that coronavirus in majority of cases, vast majority of cases, is a mild disease and usually self-limiting. Usually people recover from the infection without any other effects. So that is what you can expect if somebody gets infection during pregnancy. And also, if the infection occurs in and around the period of delivery, then the chances of cesarean or vaginal delivery is the same like for other women, so that does not change. And breastfeeding also does not change. A woman who has had in the recent past coronavirus infection or is presently having coronavirus infection can still breastfeed her baby. So these were a few tips. I hope it was useful. Thank you very much.